Great. So Kelly and Nicole, please take it away.
Great. Thank you, Ashley. I'm really excited to be here to tell you a little bit about the College of Pharmacy. My name is Kelly Orr. I'm the Associate Dean of Student Academic Affairs here at the College of Pharmacy. Been here for a little bit over 20 years, and I've seen pharmacy evolve and also our other program, which is the Bachelor's of Pharmaceutical Sciences. So I'm excited today to talk to you as students who are looking into pre-health careers, to let you know a little bit more about what our Bachelor's of Pharmaceutical Sciences can offer you, especially in preparation for medical school, PA school, dental school, what kinds of things you can get out of a program like this to help prepare you for those exams, for those rich experiences, and then to also move into a professional curriculum. But at the same time, I want to let you know a little bit about the PharmD program, which is the Doctor of Pharmacy, which you might think of just a community pharmacist at a CVS, something you would do to be a pharmacist. But I would say after the last 20 years that we've seen such a growth in the careers, and particularly clinical careers for pharmacy. So I want to also open your eyes to another aspect of the pre-health career, which would also be a licensed pharmacist too. So over the next 30 minutes or so, I just want to talk to you about who we are at the College of Pharmacy, what you should be thinking about if you're considering a pre-health major or career, what our curriculum offers in terms of offering you that support and that knowledge base as you move into these career paths, how we are involved in the community, what sort of outreach we had, and all the different post-grad opportunities. I know obviously the goal is to have a career, a healthcare career, but there's many different things that are available out there, and we want to let you know about them. And lastly, how you're going to connect with us at URI. So I just want to briefly introduce my colleagues from our two different departments within the College of Pharmacy. First is Dr. David Rowley. He is the intern biomedical pharmaceutical sciences department chair. Hopefully I said that right, Dave. Close enough. And Dave, do you want to just tell us a little bit about your background and how long you've been at URI?
Sure. I joined URI in 2001, and obviously I enjoyed it so much that I've stayed all these many years teaching pharmacists as well as researchers. I've had students that have gone on to medical school. I've seen people go off into so many different career paths, and I'm excited to tell you why our programs may be ones that you might want to consider.
Thanks, Dave. Next, I want to introduce Dr. Nicole Asel, who's in the Department of Pharmacy Practice and Clinical Research. She's a clinical associate professor. And Nicole, do you want to tell us a little bit about yourself too?
Yes, thanks for the introduction. So my name is Nicole Asel. I'm a clinical associate professor in the PharmD program, and I work primarily with students in two areas. The first is taking students on their clinical rotations. This applies to our final year, or what we call P4 students, the fourth professional year, our final year students. And then I also teach throughout the curriculum and coordinate some of the courses in the first year of the professional program. I've been at URI since 2012 after completing a residency, which we'll talk about in a little bit. And I'm one of the I would say, unique few who also has a bachelor's degree in biology. So I definitely can speak to some of those pre-med courseworks and how they can translate into the pharmacy path. So
Great. And are you seeing my slides okay? Are they progressing?
No.
We're seeing them, Kelly, but if you could do presenter mode in your slides, I don't think that it's we're just seeing the first slide. Haven't seen any.
Oh, you know what? That's I'm sharing the wrong screen with you. That's probably why. So sorry. Let me do my. I was like, why is that happening? I have two screens up. Let's try this.
Hey, perfect.
All right. And is that working now? That's great. You're probably wondering why I have why I have Dave and Nicole right there. All right. Sorry about that. Moving on. As I mentioned, we have two programs, the Doctor of Pharmacy, but also the Bachelor's of Science in Pharmaceutical Sciences. The PharmD, if you come straight in from high school, is a 0 through 6 program. But like Dr. Asel said, she came in with a bachelor's degree in biology. So she then moved to pharmacy school afterwards. So this is also an opportunity, and many pre-health programs also aim towards helping you support through pharmacy school. We have the Bachelor's of Science in Pharmaceutical Sciences. This is a 4-year degree with a focus on biomedical and pharmaceutical science, and especially in teaching you research techniques as well. And last but not least, we are part of the interdisciplinary neuroscience program. And so we have the pathway in neuropharmacology. So again, the 2 different programs, we also have many different options as far as, double majoring, having minors, having joint degrees. And a couple things with the PharmD is that we have a joint degree with the Masters of Business Administration, where you can finish that at the same time with as little as 8 additional courses. We also have a pathway to have a dual degree to get your master's, and that would also be in pharmaceutical sciences, where we have a few different specializations, being medicinal chemistry or toxicology, pharmacology, just to give a few examples, or health outcomes. And lastly, we have some students who also join the Chinese flagship to really have that concentration in Chinese language. And then with the Bachelor's of Pharmaceutical Sciences, we see many students come in and they also have additional minors and majors. In fact, we have one student right now who's also majoring in the neuropharmacology at the same time. We have many different international opportunities, particularly thinking about going to France and working in the industry over there. And last but not least, we also have an accelerated bachelor's to master's, where you can take a third of your credits during your last year, and with an additional year, finish out your master's degree, similar to what you might do with the PharmD too. All right, so Dr. Rowley, would you like to talk a little bit more about the program and the road to different pre-health programs?
Sure, I would. Thank you, Kelly. So a little over a decade ago, the College of Pharmacy decided that we were missing out on an opportunity to train the future scientists to discover drugs, figure out how to best get them to the patients that they need them, and find out what happens in populations once those drugs have been released. And the reason why we're missing out is because we have an amazing faculty in the College of Pharmacy that have diverse areas of expertise ranging from drug discovery and medicinal chemistry to pharmacology, pharmacokinetics, the way that drugs are metabolized in the body. These faculty are doing research in state-of-the-art laboratories. We have, as you'll see in an upcoming slide, a very broad base in terms of research funding. We're one of the top funded college of pharmacies in the United States. And so we thought, why are we not training future scientists? Well, as it turns out, we are doing that now, but this is also probably one of the best kept secrets in terms of preparation for medical school, PA school, and other healthcare related professions. Because everyone who comes through this program is focused on human health. So if you want to go into one of these programs, what are you going to be focused on in your career? Human health. And so what we've found from some of our students who finished this 4-year degree is that they have a real competitive edge for medical school applications. They have amazing preparation for the MCAT. They've had good medical school success in terms of admissions. And perhaps another reason why the pharmaceutical sciences program has been such a good program for these, future doctors and PAs and whatnot is because they get authentic research experiences while they are here with us. And oftentimes people who are wanting to go off to medical school or other healthcare related professions are searching for research opportunities. And in our program, you're going to get it. Next slide. So in the pharmaceutical sciences program, you'll have all of the prereqs necessary to apply to medical school. as an example. You'll have the general and organic chemistry, general biology, biochemistry, microbiology. We will substitute in a couple of physics classes for gen ed so we can make sure that you check all the boxes in terms of what you need in order to be ready for your medical school application. But also in those first couple years, you'll start to have other courses such as anatomy and physiology. By the time that you get into your third and fourth year, you're going, as you'll see in upcoming slides, you're going to start having advanced coursework in pharmacology and pathophysiology and in other areas, as I mentioned, that are very much related to human health, which is a little bit different than you would get if you were in, say, a biology program or other programs that also are good launching pads for medical school, but may not have that human health focus that really accelerates your understanding about how science and health are really interrelated. Next slide. So in the BSPS, as we call it, the Bachelor's in Pharmaceutical Sciences, these are some of the specific courses that you might be taking in your junior and senior year. And those that have a star next to it are courses that would integrate very well into the types of courses that you might encounter in, say, a first year of medical school. So when we're teaching chemistry, it's going to be medicinal chemistry. We teach metabolism, how humans metabolize drugs, and we all do it a little bit differently. So, what happens to a drug when it gets into the body? That it comes down to the pharmaceutical pharmacology. We teach about both small molecule drugs as well as the more modern, large biologic drugs that are finding more and more of a place in our healthcare system. And up in the left-hand corner, you can see a student that is interacting with a patient simulator. And whether or not you're in our Doctor of Pharmacy program or the BSPS, we have this amazing simulation facility. It looks like a hospital suite right here in Avedisian Hall, where you walk in to what looks like a hospital room and you are interacting with a patient that is respiring, and you can check their pulse, you can look on the screen, you can see what their vital signs are, and you can even make an intervention to see whether or not you can solve some kind of a medical issue. If you're taking pharmacology, you might be able to go in and see what is going to happen to a patient. This is something that's, I think, very unique to our college and our programs. Next slide. And as I alluded to earlier, there's experiential education. So all of our students are expected to be involved in biomedical research, something that a medical school or PA school, dental school might be looking for. That research is going to be under the direction of a world expert in a particular area of pharmacology or toxicology. My own personal area of interest is in the discovery of drugs from nature. We have people doing vaccine delivery, oncology, but this is a very hands-on research experience. Our students are the ones who are operating the instrumentation, and we have amazing facilities here. We have a core facility with $5 to $6 million worth of the latest research instruments that we rely on for doing our grant-funded research, and we want our students to be part of that. Some of our students also get amazing experiences by doing external internships, and we have students that are going off to places like Pfizer or Takeda, Amgen, you name it, finding opportunities to do research in pharmaceutical companies during their summers or perhaps even during the school year. Next slide. So overall, what we see is that not only did we develop a program where we're preparing students for becoming really important scientists working on the future of new drugs and helping to bring those to market, but we're also training students to become amazing physicians, PAs, because the type of coursework that we provide leads to various different pathways. So we have some students that after 4 years decide, well, I thought I wanted to go to medical school, but now I really love research. And off they go to a PhD program. And we've sent students to amazing PhD programs because of the preparation that they have. Or they want to take a couple years and figure things out, and they get really well paid jobs in the pharmaceutical or biotech industries. Or off they go to medical school or to some other career pathway. And we're celebrating all of those successes for our students. Some of our faculty have even decided that they would just want to start their own company. And, perhaps if that might be you someday, you'll have a network of individuals that you can draw upon for whatever career path that you're thinking of. Next slide. So we invite you to come to an upcoming BSPS faculty and student panel where you can hear about some of the experiences of our students. And if you can't make it live, I'm sure that this one too will be recorded and posted online. So you can visit our website and see some of the conversations that we've had, both from the faculty, students, as well as alumni, that might help you in your decision. Next slide.
Great. Thank you, Dave. That was a wonderful overview of the program and all the different things that the Bachelor of Pharmaceutical Sciences really can offer an individual. And I liked how you talked about, how it could tailor to your needs. If you are thinking of a pre-health career, there are several aspects of the curriculum that will definitely gear you up for future practice, for that research that will set you apart from other people who are applying to medical school and PA school. So I really appreciate that. Thank you for your time and insight. So we're going to switch gears a little bit and just talk a little bit about the PharmD program. And again, earlier I mentioned, I think we traditionally think of pharmacists as those that work in a community pharmacy like a CVS, for an example. But the truth is that less than half our graduates are really going into community pharmacy. And though it's so important to have a good community pharmacist that you can rely on, there are so many clinical jobs that we're seeing our students go into as well. So I'm going to start to hand it over to Dr. Asel to talk a little bit more about the PharmD program.
Thanks, Kelly. I'm really proud to say that I have experience in 4 out of 6 of these that are highlighted here on the screen. So we'll go through them one at a time, and just to orient in case some of this vocabulary is new to you. So hospital and clinical work refers to any time you might go into an actual health system, a big hospital. You might unfortunately have to get admitted to a hospital, or a family member has to stay in the hospital to receive treatment. You might go and see someone in the hospital, see a provider in a hospital, maybe a specialist. Ambulatory care refers to an outpatient clinic setting. So people who are going to see their doctor, or going to see their pharmacist, going to see their nurse practitioner or their physician assistant. Industry is, as Dr. Rowley was referring to, this is the pharmaceutical industry, working in drug development, working with our clinicians who are serving patients. There's a really, I would say, booming role for pharmacists here. We have a lot of really expanding interest in this field. Academia, which is an area that I'm aligned with. This is where we're teaching the next group of future pharmacists. Community pharmacy, as Dr. Orr mentioned, this is your probably most patient-facing opportunity to interact with a pharmacist. You can go to any chain or independent pharmacy and ask a pharmacist. They are by far the most accessible healthcare provider out there, and just a well of knowledge. And then we have managed care, which focuses on formulary management. You probably are aligned with insurance companies and what drugs are covered and why. There's rules and evidence to support all of those things, as frustrating as they might be. So there's an opportunity for pharmacists to help guide patient care there. So my personal experience, for anyone who just to give you an idea of what your path could look like as a PharmD. Before pharmacy school, I worked in a community pharmacy in my home state in the Midwest. After I completed my bachelor's in biological sciences, then I went to pharmacy school. When I was in pharmacy school, I interned at the hospital where I did my IPI, or one of my rotations. They kept me on as an intern, so I had a lot of hospital experience there. Then when I went into my residency program, which we'll talk about, it was had a strong focus in ambulatory care. But like all first-year residencies, I had exposure to the hospital setting and the inpatient side as well. And then, of course, now I'm in academia as well. We've had a lot of students recently launch into industry, and my husband, who's also a pharmacist, as it happens, used to work with kidney transplant patients, and he has now transitioned into the pharmaceutical industry. So there's a lot of opportunity, even if you spend a decade working in what we term clinical practice, working directly with patients, you can always shift sort of left to right or diagonally on this slide. Next slide, please, Kelly. So one of the aspects that I think sets a PharmD apart from other healthcare professions is this blending of really in-depth medication knowledge with specialized therapeutic knowledge so that we can take better care of our patients. All of our healthcare colleagues in different professions get some degree of medication education, but absolutely not to the degree that a pharmacist does. So that's really what sets us apart. And as we step into these clinical roles where we are working sometimes independently and oftentimes with other professionals, healthcare professionals, we're working to optimize medications for complex conditions. So you may see a pharmacist and only a pharmacist to manage diabetes or high blood pressure or any number of other conditions. We oftentimes work within healthcare teams, so with a physician, with a nurse, with a physician, a nurse, and a physician assistant. We have a great interprofessional education day with our colleagues at Brown University, Rhode Island College, the College of Nursing, physical therapy students, social work students, where we're all working together as a team to take care of our patients. We can also go on to specialize to support acute care. So this might be patients who are in the ICU or babies who are in the NICU. This can also, you can also specialize to serve transplant patients, oncology or cancer care. And then really no matter what role you go into pharmacy, there's always going to be a patient education piece. Sometimes maybe if you're in the pharmaceutical industry, that education is provider facing. So you're working to help providers understand the best way to use the medications that are available to them. And as Dean Orr already highlighted, we have a lot of different clinical settings that we can work with this skill set. Next slide, please. So the PharmD curriculum is broken into two phases, we can say. The first 2 years is considered pre-professional and general education. These are your chemistries, biologies, calculus, research, writing, ethics, and communications. And then the second portion, which is the portion that I have the most engagement with, is the professional curriculum. So this is where you might hear us refer to our students as a P1, a P2, a P3, or a P4. So we're referring to first year, second year, third year, or fourth year PharmD students. So even though they might be in their, fifth year of college, we're still referring to them as maybe a P3. So there's 3 years of coursework in the classroom. We refer to that as our didactic coursework. And then in the final year is the advanced practice rotations. That's where I work with students at the currently at the Providence VA Medical Center to complete one of their several required rotation experiences. Anything to add, Dean?
This is our general 06 pathway. And I'm so glad earlier you talked about how you had a degree prior to coming to pharmacy school. We do have that direct entry from high school, but there is the opportunity to join us after you already have a degree, or if you've had at least 2 years of pre-professional coursework, could be 3 years. You know, there's many different pathways where you can enter the PharmD program. And like you said, the first professional year is really where that education starts regarding pharmacy.
The way that our curriculum is currently set up, and I was part of the committee who was responsible for reorganizing this several years ago. Hopefully we don't have to do that again anytime soon, but we are passing with flying colors in terms of accreditation. But I love the way that we have set this up because we refer to this as a spiralized curriculum. So what that means, as you can see with the beautiful arrow there in the middle, what it means is that we are starting early in the curriculum with common outpatient conditions, things we just completed, high blood pressure, hypertension, dyslipidemia, or high cholesterol. I just went over anticoagulation with the P1 students a few weeks ago. We're going over congestive heart failure. So things that affect a large number of patients, but they typically are outside of the hospital for. We will, as the curriculum continues, we will spiral back to each of these disease states, but explore the more complex presentations. So what happens if someone's high blood pressure goes unmanaged for too long? Or what happens if someone's congestive heart failure, CHF, requires hospitalization? How do you treat those patients? And that will take us all the way to those acute chronic illnesses. This is also where we cover things that only only get treated in the hospital. If you have a particular type of surgery, if you have something like pancreatitis or a GI bleed from either a medication or from another disease state, we discuss all of these in the curriculum. And then when our students go on to their APPEs or their advanced practice pharmacy practice experience, this is also where our students get really I'll use the term hands-on experience to now treat these conditions outside of the classroom and working with real patients and their family members and health systems. Next slide, please. This is another view of our experiential education. So as you can see on the left-hand side, we have our the blue arrow on the left is referring to the portion of our curriculum that is helping our students to become what we call APPE ready. We want our students to be able to walk into any hospital, any pharmacy setting, and have a baseline knowledge that they can then build upon when working directly with patients and other providers. And then once they get into their APPEs, in the bottom left, the gold arrow, we want our I always mix up students and patients. We want our students to become practice ready. So we want them to build on their classroom knowledge and skill set on their experiential rotations so that they can go on to, of course, pass their examinations, but also go on to serve patients as licensed pharmacists in any number of career settings. So starting at the top in the yellow, we have our IPPE experiences. This is 300 hours that is split between community, hospital health system, and or public health. Dean Orr, feel free to jump in and correct anything that I might be getting wrong there.
Yeah,
but generally,
no, that's okay. The public health IPPE is actually a newer one that we are implementing this fall. And that is really hands-on experience with vaccinations, for example, those hours counting towards your experiential, naloxone training. So those issues that you may see as a patient, really, and things that you may hear in the news that impact public health. And that, again, that's a little bit newer, and we're excited to implement that this year.
Yeah, and all of our students are certified to provide immunizations after their P1 year. So the timing is purposeful, and it goes on to serve, most importantly, patients, but also our students get a wide variety of experiences because of the way that our curriculum is set up to help them to be successful. There are a number of professional development pieces that are integrated into our curriculum, service learning, where our students are going out into the community and interacting with all sorts of different projects projects. I'm sure that we could have a whole presentation just on that, but it is a required component of the curriculum. There's a professional portfolio where students are required to complete different reflections, attend different types of seminars that will aid in professional development. And then there's a capstone course that brings it all together before our students go on to their APPEs out onto rotation. And then finally, the other area where I have much of my URI experience is in the advanced pharmacy practice experiences, or what we call APPEs. And this is over 1,000 hours, almost 1,500 hours of on-site experience. There we have several required experiences, which is ambulatory care. So that sort of clinic type of experience or setting, rather, community pharmacy, which we've talked about, hospital or health system, inpatient acute care, and then our students can choose from 2 different electives. I've worked with students on electives doing research, doing writing assignments, or writing papers, rather. Students can pick on any number of specialty areas: infectious disease, cardiology, pediatrics. There's just a bunch, and I'm sure there are a lot more that, of course, there are a lot more that I'm not mentioning. So this slide, please feel free to refer back to this, gives you a good idea of how everything is sort of tapered throughout the curriculum, and it builds upon to get our students to that P4 year and then ultimately out into practice. Next slide, please. All right, so you've heard me mention residency training a few times up until now. So I just want to start briefly with what residency training is. This is not required as a part of getting your PharmD. A residency is essentially a year or 2 of really focused, dedicated, and intense training, particularly and oftentimes in a particular area of study. So our students will graduate and get their PharmD. We actually just had our match day last week, so these numbers are fresh, hot off the press. So last week on Wednesday was match day. This is an intensive, rigorous process for our students that starts back in the fall. They start thinking about if they want to pursue postgraduate training, and they oftentimes will go to a national conference and meet in person with many programs. They have to fill applications. They go to sometimes multiple rounds of interviews, and then they rank the programs according to their preference. The programs rank the students according to their preference, and then the computer does its magic. And if you match, if your number 1 and number 1 go together, it's a match. And hopefully everyone is, for the most part, everyone is always celebrating. This is not unsimilar to what happens in medical school. Actually, medical students just had their match day 2 days after pharmacy had their match day. So in the same way that medicine can go, and oftentimes, I believe in medicine, it's much more of a requirement, but in pharmacy, I would say it's a requirement for certain types of clinical settings, but absolutely not a requirement for others. So depending on what area of practice a student wants to go on to work in, if it's something that's patient facing outside of a community hospital, oftentimes a residency is the most efficient way of getting to that type of job these days. So just a few stats that we want to share with you because we're really proud of them. And again, they just came in last week. So we have a match rate of 83.8, almost 84%, compared to a national average of 74%. So what that means is that of our students who are seeking a residency program, 84% of them have matched for a postgraduate year 1. Now, the difference between postgraduate year 1 and postgraduate year 2 is that postgraduate year 1 is by accreditation standards broad. So it's in some ways similar to a rotation year where students, at that point, they'll be licensed pharmacists, students, and then pharmacists will go on to have, again, a varied number of experiences, oftentimes ambulatory care, inpatient medicine, but usually there's some sort of an aspect of interest. For example, for me, when I did residency, I knew that I wanted to serve the veteran population. So when I was looking at residency programs, I only looked at VA hospitals. And I matched with a hospital in Richmond, Virginia, where I did my postgraduate year one pharmacy residency. The VA is really sort of notorious for really strong pharmacy presence in ambulatory care. So while I got those other experiences, I also had a really strong focus in ambulatory care and really built that skill set. Postgraduate year 2 is an extra layer of specialization that this is often required for areas like transplant, oncology, cardiology, infectious disease. So working with antimicrobials and using them appropriately and helping other healthcare providers to do the same. Let's see, I think pediatrics is another one. There's nuclear, which is really specialized. But so the postgraduate year 2, again, is the second year training on top of finishing your PharmD, finishing your first year, and then going on to do a second year. So we are #1 in terms of match rate in the Northeast, and we're #9 in the top 10 for the entire U.S. In terms of PGY2 match rates, we have a 94.3% match rate compared to a national average of 86%. And we're #3 in the US in terms of PGY2 match rate. So we're really proud of that. Our students work so hard for this. They are so well prepared. We like to think that we have a small part in that, but most of it, of course, is the students. And Dr. Orr has included some of the areas that our students are going on to complete their residencies, places like the Mayo Clinic, Sloan Kettering, Henry Ford, UNC Health, Texas Medical Center, along with so many others. Next slide, please.
Well said, Dr. Esel. And just speaking of matches, I just threw in, we actually had a PharmD graduate who did match with her medical school residency. And so we've had a number of students, like Dr. Ellie said, go through the BSPS program and then move on to medical school. We've also had some PharmDs who do the full 6 years with us and then move on to medical school. And so with Kendra's permission, we are sharing her residency match, which also occurred last week, where she is now going to specialize in anesthesiology, which really makes sense knowing her love and interest in all medications. And so having a really strong understanding and grasp on especially medications that in anesthesiology, such a key component to managing those patients. So we want to congratulate Kendra.
I think she might be our second, actually, future anesthesiologist.
Yeah, I think she is.
One has already graduated. Yeah.
Yes, and I think he's chief of anesthesiology now.
Yeah, absolutely. Yeah. So as the slide here shows, we are the #1 public university in New England, which we are so proud of. We have a higher than average on-time graduation rate of 94%. I would say, if I had to pick one of these that I'm personally most proud of, is the bottom right, the 98%, which is alumni said that they would opt to study pharmacy with URI again if given an option. That makes us so proud. We really do everything we can to support our students from those what I'll term our undergraduate training, those first 2 years, and then into the PharmD program. And that's something that we're all just so proud of. Next slide, please. All right, and then finally, just to sort of drive home the point of what options you have when graduating with a PharmD degree. Again, 98% of our students have we have a 98% employment rate as of 2024. Our 2025 graduates are getting ready to walk across the stage here in a couple of months. 98% employment rate at graduation. Mean salary, and that's across all different arenas of pharmacy, is almost $130,000, which is important and always, I think, a bonus. Bringing your attention over to the left-hand side, the graph here, you'll notice that in the bottom, the biggest section is in this sort of dark blue, not quite rody blue, but dark blue color in 38% hospital. And I think that that probably includes our students who are going on to do residencies. Most of those do take place within a health system, but there are also residencies that are focused in the community space or specialty pharmacy as well. I would say, again, the other biggest pieces of the pie would be the two green sections on the top right. So the chain community pharmacy at 19% and independent community pharmacy. Those are distinct, but we consider them both community pharmacy. And then over on the left-hand side, we have all of the other areas that really bring us to a whole pie here. We have on the bottom left our clinic-based pharmacy. This is what we would usually be referring to as ambulatory care, just to use the same language as we had before. We have a government and regulatory agency. This isn't just like VA, as I was saying in my experience. This also can be Centers for Medicare and Medicaid. This can be the public health service. We've had a lot of students who do a rotation there and then stay on through the public health service. Managed care, there's a portion there for academia, which is near and dear to my heart. We do have a very small percentage who either don't have immediate plans or they choose to go into something non-pharmacy. I'm not sure if that captures our medical students or not, but that might be where they fall. And then again, in the top left corner, that brown at 8%, pharmaceutical industry, this is an area that we really have a big growing interest and a lot of really unique roles for a pharmacist to step into right after graduation. So I expect that that piece is going to get bigger in the next couple of years. Finally, we have an alumni and student pharmacist panel coming up in April. Again, as Dr. Rowley said, it will probably be recorded if you can't make it live, but you can sign up or register to attend at uri.edu/pharmacy/PharmD panel. And we have several of our recent and not so recent graduates that are in a diverse community and non-community pharmacy settings. And then we also have several PharmD students, one of which I'm actually working on a paper with. That was part of one of their rotation activities. So really good opportunity to learn more about pharmacist roles post-graduation.
Thanks, Nicole. And
Thank
also
you.
here, just that was excellent. I appreciate, going in depth with a lot of those acronyms too that we have in pharmacy. You and I just rolls off our tongue. But the APPEs, the IPPEs, those are all experiential components. And I hope that individuals watching really understand that it's more than a quarter of our curriculum, that hands-on experience. Just as Dave talked about the hands-on research and the experiential credits that happen with the bachelor's, we have many more hours also that can go towards the pharmacy component too. So just moving ahead, just to tell you a little bit about us at the university and the college, what kinds of things we have to support students. We have the Academic Enhancement Center, but we also hire peer tutors within the building too to help support our students. Many of our students are also eligible for the honors program. So coming in with a certain GPA, you may be, proceeding with that, where you would also complete an honors project. We always have wellness events. Behind me is the medicinal garden when it's warm and sunny out. And also behind Nicole is the same garden, but lit up at night. And to, the left on my screen here is Dr. LeMay, one of our wellness champions, doing yoga in the garden with our students. So we very much want to support wellness and all that goes with it. It's stressful to go through school, especially if you're preparing for that pre-health career. So we want to make sure we take care of you. We have many transfers. We have commuters also as students, and we have lots of study spaces and areas for our commuters to also, put their stuff down for a day. We have lockers in the building. We have areas where you can sit and eat and study and make yourself comfortable. Of course, we have several academic advisors, including both Dr. Rowley and Dr. Asel, who are on this call. We also have peer student mentors within each of the programs too. Now, if you come in a little bit earlier, you might be able to do study abroad, but if you can't do study abroad your sophomore year, there are several J-term opportunities, and one in particular, and Dr. Rowley may be able to talk about, and also Dr. Asel, both going to Indonesia at some point, which was a great J-term experience, where they got to, look at the healthcare systems there, learn about what they're doing in Indonesia, and just a great, when else would you go to Indonesia and travel to all these wonderful places? So lots of different things that we can talk about and you can sign up for too. We talked about the matches. Thank you, Nicole, for going into such great detail. But also on the side here, we've got all the different careers in as a pharmacist to the left and also to the right with pharmaceutical research and pharmaceutical careers. So if you had a minute, pause this video, take a look at that, and you can learn a little bit about the other opportunities should you not move into medical school or PA school, and you can see what else is out there, what you can do with the degree. We've been working very hard on our social media. Not me. I don't know anything about social media, but we've got lots of people that do. And so we would encourage you to find us on TikTok. I can even find it. They're very fun. We've seen some great highlights of the building and all the things that are going on. We're in LinkedIn and we're also on Instagram. And we very often feature our students in Instagram too, and our faculty and what's going on. And here's our TikToks again. I don't think they're gonna work. I'm not gonna play them. But these are some of our more trending ones, if you will. And then towards the end here, other ways to find us on X, Instagram, TikTok, Facebook. Find us online. We welcome a visit from you as well. We hope to hold a meet and greet. And, should this presentation inspire you to come meet us in person, we'll be here April 7th at 4 p.m. We just ask that you sign up using the QR code below so we can know we're expecting you. It's a chance to meet you in person, give you a tour of the building, and provide you with more information about our two great programs. And if there's any questions, we'll pause here for a second and see if we can answer anything. And we might not have any questions.
Well, Kelly and Nicole and David, thank you so much for this. This is really helpful. I think it would be great to understand the day-to-day because it's easy for students to understand what a physician does day-to-day versus what a pharmacist does day-to-day. Another great example, and this has been coming up a lot, students that are interested in going on to be, you had mentioned your student who's moving into anesthesiology. I get a lot of interest in students who want to go on to be CRNAs and, do nursing work within anesthesiology. So just kind of being able to give a snapshot of, if a student is going into peds, like you had mentioned, Nicole, maybe as a pharmacist, what might their day-to-day look like in peds as a pharmacist versus what would their day look like as a pediatrician, as a physician? Are there a couple of key differences there that would help students to understand the main differences?
Yeah, thanks for that question, Ashley. I think it depends on the area of practice. I can certainly compare my practice at the VA, which of course is an adult at this point in time, generally male population, with Dr. Matson, who works in a pediatric ICU or a NICU. And because we're both in the inpatient setting, our days oftentimes may look very similar in that we start our morning reviewing our panel of patients, reviewing all the medications they're taking. In my case, we're reviewing things like kidney function and liver function that may not be, those organ systems may not be working as well in our older adults because of comorbid conditions or other things they have going on in their body, or because of the illness that they're coming to the hospital with. And certainly in Dr. Matson's scenario, as well as as my now 4-month-old was in the NICU, certainly there's a lot of organ systems in there in his case that needed attention. So the pharmacists and pharmacy students are the ones reviewing those medications, making sure the dosing is correct for their weight, particularly in our little babies. And for our older adults, we're looking at a lot of other disease states and other medications that may impact what we are prescribing or what the patient is receiving. So we start our day reviewing all of that. And then in the inpatient setting, we're actually working with the medical team in what we call rounding, where we're standing shoulder to shoulder, sometimes right next to each other, in front of the computer, sometimes in the hallway, reviewing all of the patients. Usually the nurses are there as well, because they're the ones spending the most time bedside with the patient in those settings, again, in the inpatient side. Then we're spending our afternoons, we're processing orders. So we're actually putting through the prescriptions. We're making calls to our colleagues to make sure that all of the orders are up to date and complete. We might be giving presentations or in-services to our other pharmacy or non-pharmacy colleagues in the hospital. So that's an example of an inpatient setting. In an outpatient setting, we have a lot of pharmacists who are integrated in. I'll use the example of a doctor's office, because I think most of us have been to some version of a doctor's office, whether it's a PA, an NP, or an MD who are providing care. Depending on the practice agreement, you may just go in and sit down with the pharmacist the same way you would go in and sit down with your physician or other healthcare provider. Oftentimes, one of the most common iterations of that relationship is you might go and see your clinician, and then let's say they're starting a new inhaler because you have asthma or COPD, and then they would send you down the hall to go sit down with the pharmacist, and now the pharmacist is the one giving you all of the education, walking you through all of the details of your new regimen, why adherence or taking your medication is important, and what you can expect from when you start that medication, and when you should come back to see us for an adjustment or if you're having any issues. I'll pause there. I can go on forever about this, but those are a couple of examples that that hopefully can resonate with at least a few people.
That was a great explanation. Thank you, Nicole. I appreciate that.
Thanks.
Well, thank you so much for this, for your team, for taking this time. I think it's important for the community to realize that pharmacy is just a wonderful option as a piece of healthcare, and that we just have this amazing program here at their fingertips as current students at URI. So thank you all for your time. I appreciate it. I'm going to stop the recording here, but we can hang on for additional questions and concerns and take it from there. Thanks so much, everybody.
Thank you.